These are the things that you get when you are taking those pictures. Some people just have those perfect teeth, white and clean. The healthier your teeth are, the happier that you look. Dr. Queen Elumaro is here to show us how to have those perfect teeth. My name is Edak Willie. See you shortly. Welcome back. Dr. Queen, please tell us, why are healthy teeth important?
Healthy teeth are important for your overall well-being. Like I've said, without healthy teeth, you won't look nice. You want to look nice. You want to be pain-free. You want to be able to use your teeth, have your complete set of teeth, so you can use it. You can use it functionally very well. You don't have any missing teeth. Your teeth are in good health, so your oral your mouth is in good health, and that will affect your overall health, because you find out that there are some people, if some people have systemic problems, that they have some health challenges, it presents first in the mouth. Okay. So you can know if someone has some systemic problem even from the mouth.
Like what?
Like if somebody have diabetes, uncontrolled diabetes, the person's mouth will have a peculiar odor. Okay. If somebody has any immunocompromised disease in the body, it will show in the mouth as well. So it's very crucial to have healthy teeth and healthy mouth.
Okay, what's the major cause of plaque?
Plaque is there. It forms every day in every human being. There's a protein that forms from when it gets inhabited by bacteria that is naturally present in our mouth. Mm-hmm. That is plaque. Okay. So it forms in everybody's mouth. Mm-hmm. The rate at which it forms differs from person to person, but there is plaque in everybody's mouth. It forms every day. That is why we need to clean daily. We need to clean our teeth every day. By so doing, you're removing it.
I heard that plaque can lead to gingivitis. What's gingivitis to start?
Gingivitis is simply infections of the gum.
Okay.
If the gum is inflamed, you say gingivitis. The gum is called gingiva. Itis means is inflamed.
Oh, okay.
Gingivitis is simply an inflammation of the gum. And that happens if these plaques that form in our mouth, if we don't remove them by cleaning, then those plaques, like I told you, there's bacteria in them. Okay, this bacteria will irritate the tissues in the mouth, produce toxins that will cause this irritation, and that's basically gingivitis. It's a low-grade infection.
Okay, so what are the common types of gum diseases?
Most common is gingivitis. Mm-hmm. You can have periodontitis, chronic periodontitis.
What's that?
That is a more advanced form of gum infection, of where you now have some degree of bone loss, and in some advanced cases, you may even have that the teeth will become mobile.
Mobile?
Yes, it will be shaking. Okay. In some people's teeth, the teeth will start to shake if the infection is advanced. So at that stage, you call it chronic periodontitis. You can also have what we call gingival recession. Like if people are not brushing properly, the gums on their teeth will begin to
erode or recede.
Okay. And the roots of their teeth get exposed. That is called gingival recession. And you can also have what you call juvenile periodontitis. It happens in some set of people, young people. Not necessarily that they are not taking care of their teeth, just that they have that inherited condition.
Can it be treated?
It can be controlled.
Okay, so how do you prevent How do you prevent it?
Basically, you clean your teeth.
But if it is inherited?
Yes, if it is inherited, see, whatever infection is there are different factors that contribute to it.
Okay.
And all these factors must be present for that disease to progress. So if you can take off two factors, the disease may be there, but it will not progress. That's why I said it can't be controlled. There's a way you can control it. Just like somebody have hypertension. Hypertension cannot be treated. It can be controlled. That's the same way. Yeah.
Bad breath, it can be irritating. It's like body odor.
That's true.
How do we handle it?
First thing, I just want to say this. I've had a lot of people come to me and they say, I have bad breath. And they don't have bad breath.
Really?
Yes. So bad breath can be real. It can be real that somebody actually has bad breath. It can be the person's perception. Some people think they have bad breath. They believe they have it, and they don't have it.
That's psychological?
Yes. It's psychological in a sense.
Okay.
And I've found in my own experience that that almost the same percentage of people who really have bad breath, you have almost equal percentage of people. In my own experience, a lot of people who have come to me that they really didn't have it. But if we go back to bad breath, the things that causes bad breath, it can be two factors. It can be that the person is not taking care of their mouth.
Okay.
So you have that there is plaque, there is calculus deposit in their mouth. Or it can be that the person has some underlying systemic conditions. Like I've mentioned before, if somebody have diabetes, if somebody have some intestinal diseases, or somebody have chronic chest infections, those things can lead to bad.
Can stress lead to bad breath?
Not that I know of, except the stress causes the person not to take care of their mouth.
Okay.
I mean, if the stress causes you not to have time to take care of your mouth, then you can say it's bad breath.
Okay. Toothache, which is a result of, I think, as a result of not taking care of your teeth. Can it kill?
No, how can?
Because I read somewhere the other time that one student died because of toothache. Let's take a break. We'll be right back.
A lot of times, our religion preaches that women hold a subordinate role in a relationship.
He said, what kind of a man will raise his hand against the woman? What is happening in that relationship? You must ask. Yes. I want to say this.
Let's take a break. When we come back, we'll continue from here. There's something called spring cleans. Once in a while, you give your system a rest. And how do you do that? You do it by eating only fruit.
And I was staying there for a while. Nobody was coming to turn me. I decided to do the turning myself. And I just turned, and next thing I had a snap. Until my father came, I told him they rushed me to the theater.
Welcome back.
Well, they are born with it, and they are going to live the rest of their life with it.
Welcome back. Please continue. Can it kill?
I just want to understand, in what context did toothache kill this?
I don't know whether it's so painful or something. They just said, oh, she had toothache. And
scientifically, I mean,
they said something about affecting the nerve, that the toothache affected the nerve and it led to one kind of pain.
There is one, we have one main documented situation where tooth problem that was presented as toothache can lead to death. For instance, if somebody has an impacted tooth, that's a tooth that did not grow out, like usually the wisdom tooth, the lower wisdom tooth, sometimes it will be bent against the bone. There's not enough space for it to come out, and you call that an impacted tooth. So if a tooth is impacted and that leads to an infection, the infection may spread. It may spread to tissue spaces, because all around the neck there are tissue spaces, and the jaw. These tissue spaces are interconnected, you know.
Okay.
So if there's an infection, if it is maybe a virulent one, it could spread, you know, and that causes what we call Ludwig's angina. Okay. And Ludwig's angina may lead to death.
So in such a case, what could have been done to remove the tooth? Would that have saved the person?
First would be to control the infection.
Okay.
If you want to talk preventive, you should take out the tooth, so that it does not lead to an infection that will spread to become Ludwig's angina. So we always tell patients when they have impacted tooth that they should take it out.
I also heard that chewing gum can help prevent teeth diseases. Is it true?
It can contribute to prevention of, it can contribute in the sense that when you chew after eating, you're increasing salivary flow. And then the saliva, God has made the saliva to perform the function of helping to clean the mouth. Okay. So if someone chews, like say for 15 minutes after eating, then there can be that cleansing action of saliva, and that can contribute to decay prevention. But if somebody keeps chewing gums all the time, and very sugary gum, chewing gum, you're chewing it all the time, you can have begin to have jaw ache. You can have that you're constantly bathing your teeth with sugar, and that can lead to problems. Decay. So that's why I said that question is. I won't give.
Recommend it.
Yes. No, I recommend chewing gum for 15 minutes. Just 15 minutes. Just after eating. Even for people who have challenges with their with the halitosis we mentioned earlier, you can chew for like 15 minutes.
Does it help the halitosis?
It can help if you chew for like 15 minutes after eating, and then you it can help, because sometimes it's the food that is left in the mouth after the person has finished.
Doctor, I can see your teeth. Is it teeth here? I think this will show us how to brush our teeth, or the kind of paste to use to have this kind of teeth. So white and everything is in place.
I just want to say that naturally, nobody's teeth is as white as this. Let me just say that.
But I see some people, they say they bleach their teeth and they come out with this white.
Yeah, there's teeth whitening. There's teeth whitening. Teeth whitening is different from cleaning your teeth. Okay. You're supposed to clean your teeth professionally once every 6 months. So you visit your dentist once every 6 months to do that professional cleaning. Because no matter how much you brush your teeth regularly, there will still be some places that you're not able to access. And in such cases, you find that deposit will accumulate, and you will need to go in for that to be taken out professionally. But like I was saying, this is the model we use to demonstrate toothbrushing to patients. So we just ask them to. We advise that you should use soft toothbrush. If you use soft toothbrush, it will prevent things like gingival recession that I mentioned before. A lot of people use hard toothbrushes, and
because you want it to be clean and shiny.
No, but
so that you can have that cheese smile.
Common sense. This is just common sense. If I brush my teeth twice daily, right, and I mean, this is you brush in the morning, you brush in the night. How many hours in between? And it's not like you went and you threw yourself into some sewage tank or something like that. So how much dirt can accumulate in between a few hours? So you really don't need to use a hard toothbrush. You just use soft.
Like some people have plaques, so they want to remove the plaques by themselves. Shouldn't they use hard toothbrush to get it off?
Normal soft or worst case scenario medium toothbrush would remove the plaque.
Without?
We will remove the plaque. The only time I can tell a patient, oh, use hard toothbrushes, maybe if the patient is a smoker, then I can ask that person to use a hard toothbrush. But ordinarily, soft is okay. Some people will complain that, oh, the soft is too small. I mean, it's too soft. They don't feel like that they're brushing. In such cases, we'll say, okay, use medium. Okay. And that suffices. That is okay. Okay. So you should brush twice daily. Change your toothbrush every 3 months. And whenever you eat any sticky food, like sticky things like pastries and all that, it's usually good to rinse your mouth afterwards, you know. And then when you want to brush, you know, most people put their teeth together when they're brushing. You know, they put their teeth together when they're brushing. And that is wrong.
So what's the death rate like when it comes to malaria?
Annually, in a country like ours, about 300,000 children below the age of 5.
Some women are not psychologically ready to engage in any form of, you know, intercourse. So they need some time for their body to heal, which some men don't have. Nigerian men don't have patience.
Sorry.
That's their flavor.
Let's take a break.
Their flavor.
Shall we come back?
You see, Nyanya, like, what's your flavor?
Welcome back. We were talking about brushing, doctor.
Yes.
Please continue.
So, like I was saying, you brush with your toothbrush inclined at an angle, up and out, and for the upper joints down and out, like that, like that, and this inner aspect like this, and here, this way. Then after that, you brush your tongue. You see, brushing like this, and then your mouth must be open. For people who are used to brushing like this putting their teeth together to brush, it may seem awkward, but just persist in it. By the time you've done it for like a week, you become used to it, and that way you brush without damaging your gum. Look at the bristles of this, but when you go up and out, the bristles go in and bring out stuff, as opposed to brushing like this, or like this. Those are not effective ways of brushing. So after you finish, I mean, like I said, you brush twice daily. Change your toothbrush.
And then talking about fluoride, you say we should use toothpaste that has fluoride?
Yes, that's what we recommend.
I heard somewhere that fluoride is not good for us.
If in excessive quantity, if it is excessive, it has its own health implications, excessive use of fluoride. But the fluoride that is in toothpaste is controlled. It's just a little amount. There are regulatory bodies that control what is in the paste.
A lot of research has gone into it, yeah.
So there are all these bodies that control what is in the paste.
I also hear about cold water not being good for the teeth. Is it true?
Yeah, I don't think so. I mean, if you want to drink cold water, you drink cold water. I mean, some people, when they drink cold water, they have this shocking sensation. That just means that a part of the tooth is exposed. The sensitive part of the tooth that we call dentine is exposed. Now, what some people do is they just go and buy Sensodyne,
some toothpaste,
and start using. But that is wrong. If you are having any form of sensitivity, visit your dentist. Let the dentist examine you. What it means is that the sensitive part of the tooth is exposed, and that shouldn't be. The part that you're seeing now is the enamel. The enamel is not innervated, so it is not sensitive.
Okay.
And that's the only part that should be exposed to the oral environment. When there is sensitivity, visit the dentist. If dentist will examine, and the dentist will tell you, oh, it may be that the patient has a decay that is starting and you don't know, or it could be it could be that there is some erosion somewhere, or that the teeth is just sensitive. So if the dentist determines that you just have sensitive teeth, then they can say, oh, go do desensitization or use a particular toothpaste.
Okay.
But the person needs to see dentist, not just do self-medication and go and buy.
Because for all you know, there could be an underlying
another
problem. Okay. So what do you say about bleeding gums?
Bleeding gums is one of the symptoms of gingivitis. It's one of the symptoms when people have plaque deposits and they don't take care of their teeth. So when these tissues are irritated, they would bleed. One of the signs of inflammation, it's one of the signs of inflammation, redness.
Okay.
In advanced cases, they can be bleeding, and so in most cases, if someone has bleeding gums, go and see the dentist. They will examine, clean for the person, possibly do some form of gum treatment, and then the person will be fine.
There's also this one, toothpick. Is it good for the teeth?
No.
But you have to remove those things. You have to pick them up.
You can, if you're eating and meat is stuck on your teeth, you can take your toothpick and drag it out.
Okay.
That is okay. What is not okay is for you to take your toothpick and be poking in between your teeth. A lot of people do it. They use it. They're poking in between.
Because you're sweet. So
that's what I'm saying. And you are having this sweetie sensation. You are poking it. Well, you're just creating spaces in between your teeth. So what will happen is that more and more food will begin to pack in those places. There will be bone loss. Before you know it, the teeth will start to shake. Before you know it, the patient will lose that teeth.
Wow.
Yes. So it is not good to use the toothpick to be poking in between. What we advise that you should use to clean in between the teeth is dental floss. Okay. It's available in supermarkets. It's like a thread.
A thread, yeah.
And then you twine in between two fingers, and then you use it to clean in between the teeth. In some cases, they've already made it to be in between
rubber,
and then you just use it to clean in between the teeth.
Okay.
But if you have like some meat stock, you can use a pick to drag it out, but don't use toothpick to poke in between the teeth. That is what is wrong.
Okay. Thank you, doctor.
Thank
you very, very much. We'll be right back. It's not really about our kitchen today. It's about some of those things that you can use in your house to stay healthy and look fabulous. There's a lot of competition out there. Today I want to talk about pregnant women. When you are pregnant, how to get back to your body after childbirth. It's very important because the competition is fierce. So prevention, they say, is better than cure. When you are pregnant, you don't have to wait till you start seeing those lines on your stomach, which after giving birth, it will turn to big stretch marks that you won't really like. So how to control it is that you apply powder on your stomach every morning, every night, so that when you feel the itch, you will not itch it, you will not scratch it, because when you scratch it, that's how the stretch marks will develop. So you prevent it by rubbing powder, any kind of powder, as long as it is white. You apply it very well all around. This will prevent those stretch marks, I tell you, you will not like after putting to bed when it comes. And you will not be able to remove it after. So prevention is better than cure. Thank you for watching today's episode, and see you next time.